Hello guys, welcome to my channel. In this episode, we will explore diseases that affect the bone. Bones provide support and allow the body to stand up straight, bend, and twist. Indeed, they literally hold us up and keep us from collapsing to the ground. Unfortunately, there are a lot of medical disorders out there that directly or indirectly affect the health of our skeleton. And even the strongest bones fall foul of any number of diseases that serve to weaken and degrade bone structure. So, what should we be aware of? And how can we maintain the health and integrity of our own unique chassis? Number 1. Arthritis. Arthritis is the swelling and tenderness of one or more joints. Its main symptoms are joint pain and stiffness. Osteoarthritis. Osteoarthritis is the most common form of arthritis. It occurs when the cartilage that lines your joints is worn down or damaged and your bones rub together when you use that joint. Osteoarthritis affects 15% of the global population over the age of 30, according to The Lancet. Furthermore, by 2050, nearly 1 billion people are projected to have the condition. Number 3. Rickets. Rickets is a condition that affects bone development in children. It's defined by the softening and weakening of bone, usually because of an extreme and prolonged vitamin D deficiency. Number 4. Fibrous dysplasia of bone. Fibrous dysplasia is a benign known cancerous bone condition in which abnormal fibrous tissue develops in place of normal bone. Pictured is fibrous dysplasia of the right zygomatic bone, the bone that forms the prominent part of the cheek and the outer side of the eye socket. Number 5. Osteopetrosis. Osteopetrosis is a bone disease that makes bone tissue abnormally compact and dense and also prone to breakage and to skeletal abnormalities. Gout is a common and complex form of inflammatory arthritis that can affect anyone. It's caused by a buildup of a substance called uric acid in the blood. If you produce too much uric acid or your kidneys don't filter enough out, it can accumulate and cause tiny sharp crystals to form in and around joints. Particularly affected are joints in the toe, especially the big toe. Number 7. Diabetes. If you have diabetes, you're at increased risk of various bone and joint disorder, among many other medical conditions brought on when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Bone cancer. As its name suggests, bone cancer begins in the bones. This is what's known as primary bone cancer, which actually is rare. More common is secondary metastatic bone cancer, where a cancer that starts elsewhere in the body spreads to the bone. Number 9. Multiple myeloma. An example is multiple myeloma, a cancer that forms in a type of white blood cell called a plasma cell. The cancer often affects several areas of the body, such as the spine, skull, pelvis, and ribs. Osteoporosis is a disease that weakens your bone. It develops when bone mineral density and bone mass decrease, or when the quality or structure of bone changes. Osteomyelitis is an infection of a bone. It's caused by bacteria or fungi and results in painful swelling of bone marrow, the soft tissue inside your bone. Hyperparathyroidism is where the parathyroid glands in the neck near the thyroid gland produce too much parathyroid hormone. This, in turn, leads to high calcium levels and low phosphorus levels in your blood. Too much calcium has been shown to increase the risk of osteoporosis and broken bones by increasing the rate of bone turnover, the cycle of breakdown and renewal of bone. Paget's disease of bone is a chronic disorder that causes bones to grow larger and become weaker. The normal, over time, enlarged or misshapen bones can stress nearby joints, leading to osteoarthritis in those joints. We hope this video has provided valuable insights into the various bone-related ailments, empowering you with the knowledge to make informed decisions about your health. Remember to prioritize regular checkups, adopt a healthy lifestyle, and seek professional guidance if you suspect any bone-related issue. Thank you for joining us on this journey through the intricacies of bone diseases. Stay tuned for more informative content, and don't forget to like, share, and subscribe to our channel for updates on health-related topics. Together, let's continue to prioritize our bone health for a happier, healthier future.